The CDC says 1 in 10 Americans have received at least the first COVID vaccine dose. But when you break it down, vaccination doses and rates are different all across the country. Thanks for staying with WJZ tonight. I'm Nicole Baker.
And I'm Rick Ritter. The vaccine disparity also seen here in Maryland. Your rate of receiving the vaccine could change depending on where you live.
Yeah, WJZ is live tonight. Paul Gessler spoke with the health officer of Maryland's top performing county on what he said is the #1 factor for this inconsistency. A lot of people talking about this, Paul.
Hi, Nicole. Yeah, so Kent County's health officer told me it is simple. It's just an issue of math. The Eastern Shore County is able to vaccinate a greater share of their population because each county is guaranteed a minimum amount of doses. And the stats show that the more populated areas in Maryland are lagging behind. Local health departments want more vaccine supply, of course, but they also want it directly.
Vaccinations are the health department's bread and butter. We do this every year with flu shots.
Bill Webb's the health officer in Kent County.
We benefit from the allocations that are distributed by the Maryland Department of Health.
Those allocations are based on population tiers, and each county is guaranteed a floor of first doses. The 10 least populated counties, under 100,000 people, right now get 300 doses from the state. That middle tier, between 100 and 200,000 people, they get 700 weekly first doses, and the 8 most populated counties in Maryland currently get just under 1,000 first doses from the state each week. Adjusted for population, Kent County is receiving about 10 times the amount of first doses from the state each week compared to Baltimore City. That's why Kent County leads the state in percentage of residents vaccinated, along with other rural counties. Meanwhile, Prince George's, the county with the state's highest number of cases, is at the bottom, with several urban jurisdictions.
We need equitable distribution, not just equal distribution.
Public health officials say some supply chain issues are to blame, but more populated areas need a greater share.
I know, looking at the rates of infection in Prince George's County, that's where we need to be. We have a lot of people living in crowded housing, a lot of essential workers there.
And we're just very hopeful that Johnson & Johnson will realize where we are right now.
To help address Baltimore's slow pace, Mayor Scott applied public pressure in hopes Johnson & Johnson would sell vaccine directly to the city, something Governor Hogan said is up to the feds.
It's a nice try. I mean, everybody would like to jump to the front of the line, but it's not going to happen.
Now, in a letter to Governor Hogan, Mayor Scott and leaders of 21 Maryland counties asked for more transparency in the vaccine allocation projections. Reporting live at 5:30 tonight, I'm Paul Gessler for WJZ.